Okay, we'll call the meeting to order. We'll join me with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, welcome to the August 13, 2025 regular meeting of the Washington Township Healthcare District Board of Directors. Public notice for this meeting has been posted appropriately on our website. Tonight's meeting is in person and is also accessible by Zoom. I ask that you please mute your system until such time as you need to speak. We are recording tonight's regular session of the board meeting. It will be posted on our website for future viewing. Cheryl, if you could call the roll.
Director Nicholson.
Present.
Director Wallace. Director Yee.
Present.
Director Stewart.
Present.
Director Epen.
Present. We'll now move to the oral communications section of the agenda. Oral communications, members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes on issues or concerns not on the agenda and within subject matter of jurisdiction of the board. Are there any members of the public who would like to speak at this meeting? Seeing none, Cheryl, do we have any written communications?
There were no written communications.
No. Very good. We'll now move on to our consent calendar. The consent calendar consists of those agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? Seeing none, does any member of the public want to remove an agenda item from the consent? Seeing none, may I have a motion to approve the consent calendar item?
I move that the Board of Directors approve consent calendar items.
Director Wallace. Director Nicholson.
Aye.
Director Yee.
Aye.
Director Stewart.
Aye.
Director Epen.
Aye. The calendar is passed. We'll now move on to our next agenda item, which is a highlight of our meeting tonight.
Absolutely.
Yeah, so I think really if you could
Yeah.
introduce this.
I'm going to introduce the two members of Washington Health, and then I will turn it over to them to introduce our other guests here this evening. I will start with Angus Cochran. He's our Chief of Community Support Services. Angus has been with Washington Health since 2006 and currently serves as Chief of Community Support Services. In this role, he is responsible for government relations for the health system. He is also the liaison for the Service League and manages community outreach in the Health Insurance Information Service. Angus earned a bachelor's degree from UCLA and a doctorate from Columbia University. It's also my pleasure to introduce Matthew Schiamana, RD. He's the Director of Food and Nutrition Services. He has been with Washington Health since 2022. He's our Director of Food and Nutrition Services. He's responsible for all food systems across Washington Health Enterprise. He earned his bachelor's degree from San Jose State University and performed his supervised practice to become a registered dietitian at Santa Clara Valley Medical Center in San Jose. We're very excited. He has been accepted recently to the Masters of Science in Healthcare Administration and Interdisciplinary Leadership at the University of California, San Francisco, where classes will begin this fall. Matthew is married and enjoys reading and hikes with his wife and 4-year-old Carolina dog. So I will turn it over to you, Angus, and I know also Mary Beauron is part of this. Okay, and Mary, as we know, she'll also be reporting later on. She's the Chief Quality Officer. She has been employed by Washington for 12 years. She received her Bachelor of Science in Nursing from University of San Francisco and worked in medical, surgical, and emergency department nursing for 7 years before transitioning into infection prevention in 2009. She obtained her Master's of Science in Nursing from the University of San Francisco. She is a certified clinical nurse leader and is certified in infection prevention. And she completed her doctorate in nursing from Samuel Merritt University. So the three of them, sorry, Mary, are going to be doing the presentation. All right, and then you have a lot of other individuals. I'll turn it over to the three of you to introduce your other guests for this evening.
Well, thank you, Kimberly. It's wonderful to be here. Good evening to the Board of Directors. And it's great to be back with our annual presentation on the Alameda County Livestock Auction. And we have joining us this evening 4 students, 2 in one screen. We have Rowan Batchelder and Meridel Lavelle. They will be talking about their animals. We have Claire Brochu, who is a very close friend of Washington Health for reasons that she'll explain through her presentation. And finally, we have Mia here, who is Mia Martin, who had a very beautiful steer that we bought half of. And I know we bought the better half, is my understanding. Can we pull up the slides, please, Shri? Thank you, Shri. And maybe we'll go to the next slide, please. So we just have a very quick introduction before we turn it over to the students. As you know, we have been working with the students and the 4-H clubs and the Future Farmers of America for a number of years now, probably more than 10 or 12 years, I think. Began as a project with past County Supervisor Scott Haggerty. We've carried that on with that tradition on with a great partnership with current County Supervisor for District 1, David Haubert. And the process basically begins soon after the process actually goes on all year, because I get a variety of thank you cards, and then I get Thanksgiving cards. I frequently get a lot of holiday cards, and I get a lot of Valentine's cards as well from all the students, which is wonderful. It really it punctuates my year beautifully. And then a serious number of letters and communications come in at the beginning of the summer from students who want to meet with Mary and Matthew and myself to show us their animals and to talk about why it is that we should be bidding on their animals in particular. So we spend a day at the livestock barn. You can see Mary and Matthew here with Mia's brother, I believe, above there, right? Is that Ryder, maybe? And one of the Gandolfo family there in the bottom. And we interview about 40 students in the course of the day, so it's quite a long day. We meet a lot of wonderful animals and their human owners, and that tees us up to the auction a couple of days later. We also get to really enjoy some great fair food for lunch, which is really the bonus for going out and spending the day at the livestock auction. So it's a full day of auctions, begins around 9, goes until about 5 o'clock, and the auction is for rabbits, goats, lambs, hogs, steers, and a few goats, although we did not get any goats this year. And generally, we are the number 1 bidder at the auction each year, too. Next slide, please, Shri. These, you can see, are our partner clubs. Our most local 4-H club is the Bayside Club. They keep their animals at Ardenwood, and we make a particular point of talking to those students and meeting with them because they are locals here living in the district. Many of them are going to James Logan High or to the junior high schools in Fremont, Union City, or Newark. And then we also partner with the 4-H Club of Sano. The FFA program is at Livermore High, and we work quite closely with some of those high school students too. Next slide. So our purchase this year, we got 16 and a half hogs. So we did partner with Supervisor Haubert on a few hogs, which is how we came up with half a hog. We got 5 lambs, and we also got half a steer, courtesy of Mia, as you'll hear later on as well. So with that, I think I'll now turn it over, next slide please, to my colleague Matthew, who'll talk about what we do with all this wonderful meat.
All right. Thank you so much, Angus, for the introduction, and thank you so much to the board for allowing me to participate in this presentation here. I'm the person, and my team are the people that get the wonderful distinction of being able to essentially create food from the animals that we purchase at the fair. So I put up a few different items that we actually have on our salon cafeteria menu. that we really treasure to be able to provide to our customers. So we have things like the torta de carnitas, which is essentially a shredded pork, a sandwich. Things like the pork and beef albondigas, pork adobo, lamb shanks, pork and beef meatloaf. These are just a few different options that we're able to create from the product that we purchase at the livestock fair. Next slide, please. And then wanted to, I would be remiss if I didn't talk a little bit about the impact from a food systems standpoint that purchasing from the livestock fair has for us. And I kind of centered it on a couple different bullet points there. The first being local food sourcing really helps reduce the transport time from farm to table. So you'll see the average miles per livestock animal, and this is kind of like the factory produce livestock animal, is anywhere from 1,300 to 1,500 miles. And this was according to the, give me 2 seconds here. According to the National Center for Appropriate Technology, which focuses on sustainability as it relates to sustainable agricultural practices. And additionally, as we purchase from the livestock auction, we're really cutting down that transit time by a factor of about 10 times by reducing the transport time. So you'll see I put 2 circles on the map there. Fremont is obviously the place where we, kind of the final product arrives. We purchase obviously from the livestock auction in the Pleasanton area, and then the processing happens over in Elk Grove. So the product is really not traveling all that far, and this cuts down that transit time and the impact on the environment as a result. Additionally, our meat purchase really helps to support sustainable farming practices that are promoted by groups like the 4-H groups, the Future Farmers of America groups that we talked about, Angus talked about a little bit earlier. And then additionally, when we think about Livermore and Sunol and these groups or these areas really have a strong agricultural heritage and really helps to train youth to participate in the practice of agriculture. So with that, I'm going to pass it over to Mary Boron, who's going to be have really the distinguished honor of introducing our guests for this evening.
Thank you, Matthew. Yes, exactly. I really appreciate having the privilege to highlight 4 of our amazing students tonight that we were able to purchase their livestock. It's really great to sit and listen to all the stories throughout the day. And one thing that is very evident, especially in these 4 presenters tonight, is that they put so much dedication and hard work into their animals. They take care of them before they go to school, after they get back from school. They do it in addition to their extracurricular activities. The sense of pride and responsibility that is brought forward when we're talking to them is just really outstanding, and especially with these 4 that we're going to highlight this evening. So I'm very happy to introduce Rowan Batchelder. He's very outgoing, has a great friendly personality. We were able to purchase his lamb, weighing in at 128 pounds, and he's a member of the Redwood 4-H Club. So go ahead, Rowan.
Well, my name is Rowan Batchelder. Today I will be presenting on my 4-H lamb project, and then I will talk about the 4-H horse project, master showmanship, and my other interests outside of 4-H.
Next slide, please.
Oh, yeah, next slide. Sorry, thank you. The 4-H Lab project is really great, and this is my 4th year completing the project. I've learned a lot from how to pick a good lamb, how to train and show lambs, and how to care for them. I've also gained valuable skills in working with other members of my project, learning how to keep going even when the lamb knocks you down, and most importantly, how to work hard and have fun. One of the things I really appreciate about Washington Hospital is the interviews that Mr. Cochran conducts. I have to prepare for the interview and make sure I know my lamb's breed and the nutritional content of their feed and the other lamb facts. But the most important thing I know I will be asked is the break-even point and my recovery cost. The break-even point is the amount of money you need to have paid for your investment. So if I spend $600 on my lamb and it weighed 100 pounds, then my break-even point would be $6 per pound at the auction. The recovery cost is how much I need to pay myself back for the project's expenses. Everything past that point is the profit that I can use for future projects or something I want to save for, like my 8th grade trip to the East Coast. Next slide, please. This year was really great. I was so much more confident, and I was able to train 2 lambs that were easy to show, and that was because I spent almost every day working with them. In addition, I made it into master showmanship through the horse project. I was very excited to be representing my club at such an awesome event. My horse, Remy, and I have bonded very well, and I was very surprised at how well we did at the horse show. After I got into masters, I had to start practicing with other animals I don't show, including pigs, steer, market goats, and dairy goats. Outside of 4-H, I'm in 8th grade, and I go to Creekside Middle School in Castro Valley. I love math, history, and playing my trombone. I play as a goalkeeper for my travel soccer team. I play for AFC, which stands for Association Football Club. I practice with my team 2 times a week and with other goalkeepers once a week, and at home whenever I get the chance. I love playing D&D with my friends, and I'm one of the only kids at school that actually does 4-H. I love board games and role-playing games of all sorts, and I play with my friends frequently. Showing sheep is just one of my many passions. Thank you, Washington Hospital and Mr. Cochran, for supporting my land project.
Thank you, Rowan. And also, did a great job. And I know that Rowan is going to soccer practice tonight even. And so we appreciate you, Rowan, making the time to be here and preparing and sharing your story. Okay, now we're going to be moving on to our second presenter, Marydel Laville. She is also another member that really has displayed great dedication and responsibility in raising her lamb that we were able to purchase that weighed in at 114 pounds. And she is also a member of Redwood 4-H Club. Go ahead, Marydel.
Hello, my name is Marydel Laville. I'm in 5th grade at Castro Valley Elementary, also known as CVE. This is my 5th year in Redwood 4-H and my first year in the Lamb Project. I enjoy soccer, art, and theater. Raising sheep has lots of steps. Step 1 is that you have to pick your lamb. Choosing your lamb takes lots of insight. Things to look for are square hind ends, but you also want to make sure that the legs are in line with the butt. The feet are square, and that you want your lamb's back to be perfectly straight. Once you choose your lambs, you have to feed your lambs and walk and exercise them so that they have plenty of muscle. You need to train your lambs so that they work well with you in the show ring. Finally, when it's time to go to fair, you load your animal into the trailer and take it to fair. And of course, you have to care for your lambs, feeding, watering, and cleaning their pens. Next slide, please. At fair, herdsmanship is really important. Redwood 4-H has got first place herdsmanship in the last 3 years. This is judged by how clean we keep our pens, aisles, how we interact with the public, and how we care for the animals. When it comes to showing, you show each lamb for market and pick 1 lamb for showmanship. In the market show, the judge is judging the quality of your lambs and showmanship. You are judged on how you handle your animal. Auction day was really emotional for me. I was really sad to say goodbye to Trooper and Cinnamon, but my mom says it's really important to make sure the animals that you have that you eat had a good life, and I can guarantee that my lambs had a very good life. Also, I was pretty excited to see my final check. I was able to open my first savings account. At least I was easily able to meet my recovery cost goals, and now I have savings to pay for next year projects and hopefully something for fun in the future. That's it.
Thank you. Excellent job.
Thank you. Thank you, Washington Hospital and Mr. Cochran.
Okay, and now moving on to our third presenter, Claire Brochu. She is also a member that we were able to interview and hear some great stories about her background and the hard work and time that she put into raising her lamb, which we were able to have a winning bid on when her lamb weighed in at 130 pounds. And she is a member of the Palomares 4-H Club. Go ahead, Claire.
Hi everybody, my name's Claire. I'm looking forward to sharing my 4-H projects with you guys tonight. So to start off, I was born at Washington Hospital 13 years ago. In fact, so was my dad and my aunt. All of us were delivered in the exact same room, which is crazy. Yeah, so that was pretty cool. Here are a couple things about myself. I live on a ranch in Palomares Canyon. I have 2 little sisters, 1 little brother. I love Jesus. I'm homeschooled. I've been showing sheep for about 4 years. My family and I started a market lamb breeding program last year and produced our own market lambs for me to raise and take to the fair. I am a cheerleader for Redwood Christian Middle School. I have 2 corgis named Sai and Tula. They are ferocious little things. This year, I've learned a great deal about breeding, delivering, and taking care of newborn lambs. We had about 3 out of 3 ewes delivered this year. Our first delivery was a set of triplets from one of my breeding ewes, Bashful. Unfortunately, we lost 2 of her triplets, having unknown lactation issues. Our second delivery was a set of twins, but Peaches, being a first-time mama, tried to have a water birth before we noticed she was in labor and delivered her first baby into a water bucket. So that was a great experience. Her second baby, thankfully, was delivered safely into the soft warm straw. Our last birth was a single birth from our ewe, Aspen, and this was a lamb that you guys graciously purchased from me. I also took 2 of my yearling breeding ewes to the fair's breeding week, Winnie and 98. They are back home now with the ram, being bred to hopefully have their first lambs this fall. So this is Lincoln and Mohican, the lambs that I showed this year. Lincoln was the first lamb born on our property. In fact, he was the first born out of our set of triplets. Because of this, I was able to work with him from a very young age. So I got a lot of time to practice with him. He was an amazing showmanship lamb that I was able to put a lot of time into. Unfortunately, we had been working on healing an abscess on his flank a month prior to the fair, and it didn't fully heal in time. So during the vet check, he was sent back home. But the blessing in this was that I was able to sell him for a lovely price to our friends who wanted to stock the freezer with some well-finished homegrown lamb. Mohican was the last of the Mohicans born out of our ewes in the in our breeding program for the 2025 show year. He was a big, tall boy from delivery. Even though he was born 2 months after Lincoln, they caught up with each other in weight. I hadn't planned on using him as my showmanship lamb because he was a little bit greener due to being a late-born lamb. But when Lincoln was sent back home from the fair, we had to pivot with each other and learn how to work better together. I'd say we did a pretty good job. We ended up placing 5th in showmanship, which was a great indication of our hard work. Next slide, please. Thank you. This is a breakdown of my recovery costs. I had made about $810 throughout my project this year. Here are some words to describe how I learned from what I learned this year. Our first word is fitting for the ring. This year I honed in my skills of shearing my lambs and took on the task of using surgical blades for the first time. I also learned to fit shag on my lamb's legs and how to prep them for the show ring. The next word is gratitude for help. I had a lot of helpers come alongside me in my trials this year. I have also had many friends and leaders take me under their wings. I'm very, very grateful for the connections I have made and the friendships that have grown this year. Pivoting with changes. This year brought many challenges and moments where I didn't know the next step to take. Instead of wallowing in the negative, I learned to pivot, pull up my bootstraps, and make the best of the situations and come out of them with a smile on my face. Patience and healing. From a lamb with a retained testicle who needed surgery to the same lamb having an abscess that took weeks of tending to help heal, I had to learn to be patient in the healing process. Our last word, educating future 4-H. I walked alongside my sister Colette and helped her train to reach her goal of becoming champion Pee-wee sheep showman at the fair, which she crushed and did in fact win. So that's all. Does anybody have any questions?
Thank you, Claire, for sharing your unique story and the lessons that you learned from your experience. This is a great story. Thank you. Moving on to our last but not least presenter, our 4th presenter, Amelia Martin. She also goes by Mia. She took on the big task of raising a steer, and we were able to purchase it, as Angus mentioned earlier, in partnership with our county supervisor. Her steer ended up weighing in at 1,267 pounds, and she is a member of Valley Vista 4-H Club. And go ahead, Mia.
My 4-H steer project is not letting me see the slides.
Oh, okay.
There we go. My name is Amelia Martin, but everyone calls me Mia. This is going to be my 6th year raising livestock in 4-H. When I'm not working with my fair animals, I enjoy riding horses, competing in rodeo, and engaging with my community as the 2025 Miss Livermore Junior Rodeo Queen. Raising my steer. Out of all the 4-H projects, raising a steer is the biggest commitment. We spend almost a year raising them. I'm lucky enough to be part of the Valley Vista Beef Group and have the opportunity to assist Seaver & Sons cattle with the entire process of raising cattle, from impregnating to halter breaking. We start halter breaking in August when the steers are about 5 months old. When we halter break, we put halters on them and chain them to walk. Then we bring them home in September. Once we bring them home, we walk them every day and start teaching them to set up. When they set up, we want their front 2 legs to be square and their back legs to be staggered with the left one forward. I also wash my steer at least once a week. About a week before fair, we clip them. When we clip them, we want their hair to be short on their face and some parts of their body. This helps give them a clean finish for the show ring. Finances and break-even point. Taking a steer is also the most expensive project. Last year, I spent $2,500 on my steer, then $2,800 for feed. We also had to get his feet trimmed, which was $50. Total, I spent $5,350 on my steer. Some exhibitors have to spend more, but I'm lucky enough to be able to have my steer at my house. I also clipped my own steer. My steer breeder, Lou Seaver, gave me the opportunity to be on his feed program, which helps me feed at a lower cost. He started his program because he believes in helping youth in the beef industry. My future plans. My first year, I had to apply for a zero-interest ag loan, in which I received the maximum amount of $2,500. My parents were able to provide the remaining overhead cost. With the check I received, I was able to pay back my loan when returning the money to my parents. The profit I made was not enough for my next project, so I requested another ag loan at $2,500, which covered my costs for the next year. My third year raising cattle, I did not need to take a loan, but chose to still apply and receive the loan, so I would have money on hand for emergency funds. Luckily, I did not need to access those funds and was able to return the money after my project was sold. That was the year I received the full amount of my fair check without owing money. I hope to continue to build those funds for the next 5 years of raising cattle so I can use the money to pay for my college education. Thank you. Without the support of buyers at the junior livestock auction, learning firsthand how to handle finances and the responsibility of learning to raise livestock would not be possible. I would like to personally thank Angus and his predecessors, Chris, for the support to me and all the exhibitors. Thank you for your time.
Thank you, Mia. That's a great story and a great example of learning some financial management skills, also in addition to all the other skills. And I know steers are hard work, so thank you. I also just want to mention really quick and acknowledge and thank our four presenters tonight for taking on the task of writing these presentations and taking place of public speaking. I think we all know that when you, and even adults, when they hear anything about public speaking, it can raise a little bit of anxiety. The fact that these four young students are able to come together and present to this audience, I think is just another example of the great skills they have. And I'm absolutely know that the four of you have bright futures, and we appreciate you taking this on. We recognize that it's not easy to come in here and do this, and you guys did a great job tonight, in addition to everything we've already heard about your accomplishments before. So thank you. I am now going to hand it over to Angus for some closing comments.
Well, thank you, Mary. And I really just want to end by giving a little broader context to what we do and explaining why it is exactly we get involved with the livestock auction. First of all, we love the product, as Matthew describes it. Not quite as much as the students love their animals, but it's a great way for us to feed our workforce with some of the best products in the world, frankly. And more broadly, we also, it allows us to participate in youth development. The students that we meet in our day of interviewing, they have so many skills. They're so mature. They have great sociability. They know finances. They understand responsibility by looking after their animals every day. They're asked to take early leadership roles, looking after the younger students, looking after their animals, and participating in a whole variety of different activities, seemingly all on the same day. It's a really impressive way they balance their time. And they're showing a lot of resilience as well. It's not easy raising this livestock, and you know, there are struggles along the way. Apparently, they also learn a lot of anatomy and physiology as well, which is we found out this evening. So I really, you know, we get a lot of compliments at the fair for how much we do to help the youth in the district and in the Tri-Valley area as well. And I just really want to thank the board of directors for supporting this project each year, for Kimberly for coming out to the fair and having such a big heart to bid on many of the animals who would not otherwise have bidders. And my colleagues, Matthew and Mary, I love spending the day with you, or the 2 days with you, interviewing the students and then also bidding at the auction. An unsung hero in this project is Alfredo Macias in FNS. He's the guy that helps break down the meat and portion it out and come up with the recipes that we all love so much. And of course, the parents and all the students who do their presentations. It's really These students are a credit to their families, and we love seeing you every year, and we look forward to seeing you again next year. Happy to take any questions for the students or for Mary, Matt, or myself.
Thank you.
Thank you, Angus. I'd invite some comments from the board members.
I always look forward to this presentation every year. This is really a very special thing. To see young people as mature and knowledgeable as they are, very, very impressive. My only regret is that, it's not able to expand this in further areas. Very, very valuable skills these kids learn.
Thank you all for presenting tonight. It's such an honor to hear your stories, and we congratulate you on your hard work and love partnering with you. Thank you for being here.
As usual, I think it's a very nice project for children. And sometimes I wonder, 20 years ago, I think the first time this was done, I wonder what the kids are, where the kids are now. Yeah. They're all good, whatever you call it, and things like that. It would be nice to know what they're doing currently. Are they still in this business of selling?
A lot of the students go on to animal husbandry courses at places like San Luis Obispo. Some of them go on to livestock judging courses at colleges in the Midwest. And for some, it's an entry point to other kinds of skills and education as well.
Nice.
Yes, I wanted to thank Rowan, Claire, Mia, and Marydell for having the gumption and courage to, come on Zoom and present before us. I just have to say that I am just so impressed at the outstanding work that you do. Angus talked about the product, but I think the product that you guys are actually doing in this program is leadership, skills, understanding business, dealing with the animals. You really are learning a lot, and it is so encouraging to see young people like you work so hard with such dedication. I'm sure it's an everyday job. And so you have all of these life skills that you're learning, which will serve not only you, but serve the community as you grow into adults. So I really am just so enthusiastic about this project. This is always the best presentation every year. It's the one I look forward to. I think about it every time that I hear about the county fair. One of these days, I'm going to join you, Angus, out there.
We would love that, Director Nicholson.
But I think it's such great work, and all of you young people are setting such a great example, and I hope more kids in your generation learn these kind of skills and learn this kind of diligence and work. So thank you so much for being here tonight. And again, thank you. So we look forward to next year.
Yes. Thank you.
Thank you, Mary and Matthew and Angus for all your hard work too. So thank you.
Okay,
Thank you.
Bye-bye.
You're welcome. You have a great evening. So our next report is with Dr. Berry. Is he on?
He's on.
Is there somewhere? There he is. And he's not in the car.
Yeah.
Not in the car, but Angus, you gave me a tough act to follow, I was gonna show my cat, but he disappeared per usual.
Yeah, I heard he's very hard to train.
You'll still be chief next year. And so, we'd like the medical staff to have representation at the auction.
I'm sorry to say that my cat's not for sale.
I don't mean it that. I mean as a buyer. Got to bid up the price. Well, Aaron, go ahead and give us your report.
All right. So this is my medical staff report for August. We have 5 new members of the medical staff to report on this month. The first is Murtaza Nazir Ali. He's a peds hospitalist. Sally Chow is a nephrologist. Jayakala B. Lakareddy is an emergency medicine physician. Bruce Nixon is a diagnostic radiologist. And Roshan Bakul Roy is a critical care specialist. We also have 8 new applicants to the medical staff this month. I'll read their names next month, but just to give you a preview, there's 1 nephrologist, 2 radiologists, 1 emergency medicine doctor, 2 orthopedic trauma specialists, 1 hospitalist, and 1 anesthesiologist applying to the medical staff. So that gives us a sum total of 668 members of the medical staff. Over half of those are active at 369. We have 39 advanced practice providers and 101 ambulatory physicians. As far as our provisional providers, there are 72 provisional active, 8 provisional APPs, and 54 provisional consulting, among a smattering of other categories. I also want to highlight that many of you already know that we are a magnet hospital, which means that our nurses are already of the highest quality standards. But we did recognize 4 that are particularly excellent at our dinner dance at the end of at the end of June. I just wanted to recognize them here. The first is Sabrina Alon. She works in our emergency department. And in particular, she's been instrumental in supply setup and process building for the trauma program. She was really instrumental in the creation and development of our trauma carts. So we can make sure we're able to handle those cases that come in and have all the supplies necessary. Gavin Cox works in medical oncology, and people highlight him as a strong patient advocate who works to provide compassionate, personalized care and promotes his patients' well-being and dignity. There's also Hai Ran Yang, who originally joined the ICU in 2008 and then joined the EPIC build team in 2011 to help make us ready for the electronic medical record. And now she works in information services where she continues to work on that passion. And then the 4th person is Sean LeBlanc, who works in our ICU, and I can tell you I work with him personally quite a lot, handing off patients to him. And he's a ball of energy running around the room, getting lines and drains and things untangled and ready to accept the patient. And I also wanted to highlight that he's the first person to win the Patient First Ethic Award. So he's continued to do that excellent work and continues to be recognized for everything he does. The final thing I wanted to bring up is just some of the interesting stuff going on in our backyard, which is just continued expansion of our programs. I specifically wanted to highlight the Da Vinci robot as an area of expansion. We continue to do a lot of general surgery and thoracic surgery cases and are now exploring opportunities for urologic surgeons to use that device. We also have a new orthopedic robot called the Mako robot. And our orthopedic surgeons are actually having a kickoff event this evening to start working with that equipment. And last but not least is the growth of our structural heart program. We've already reported quite a lot about our TAVRs over the past 2 years, but we've had continued growth in our MitraClip and Watchman device and are starting to explore opportunities for the TriClip, which would work on the tricuspid valve. So I just wanted to highlight those things that keep Washington Health at the cutting edge of care and bring top-notch quality equipment and proceduralists to our community. And that's everything for my report. Are there any questions?
Thank you. Any questions for Aaron?
Good job.
Thank you, Dr. Berry. I wanted to thank you for highlighting the magnet program because that really helps with our nurse quality. It ensures that we have the highest quality nursing here. And also thank you for highlighting the 4 nurses that you highlighted. So they're all excellent and know them as well. And I agree with your comments. So now you got to go take care of your cat. I'm sure they want to get fed just like those other animals. Thank you again, Aaron.
You're very welcome. You all have a great evening.
Okay, take care.
You too. You too.
Okay, Sheila. Boy, you've had some tough stuff to follow now.
I know, it's going to be a tough one tonight. Let's see how I do. Good evening to all.
Volunteers are like herding cats, so.
I have no cats or dogs at home to show, sorry. Well, good evening to all of you. I extend warm greetings on behalf of all our volunteers. In July, 312 Service League volunteers contributed 2,915 hours of service across various hospital departments. We welcomed a new group of 42 volunteers during orientation on July 29th, including 12 adults, 17 college students, and 13 high school students. They were introduced to our hospital protocol, Service League expectations, and the various opportunities that's available to them throughout the hospital. This summer, we introduced new Service League uniforms featuring an updated logo. We are currently in the process of transitioning from the old uniforms to the new ones. Returning volunteers appreciate the consistency of retaining the same burgundy color. I want to especially thank the marketing and communication team for their help with the design and rollout of our updated logo on the new uniforms. On July 24th, several volunteers attended the Fremont concert in the park, helping to promote awareness of the Service League and volunteer opportunities. It was a lively community event and a valuable chance to connect with the local residents in an informal setting. I'd like to share an update on the birthing center tours, which our volunteers have been leading since December 2024. These tours help families become familiar with the facility and its resources before delivery. Between December 2024 and July 2025, we conducted 51 tours with a total of 339 attendees, averaging roughly 6 tours and 42 attendees per month. The tours have been well received. A few participants mentioned that they were former student volunteers at our hospital and are now returning as expectant parents, a meaningful full circle moment for all of us. Many also shared that the tours helped answer their questions and reduce anxiety about the birth experience. Throughout these visits, the nurses create a welcoming and supportive atmosphere, making the experience very informative and comfortable to everyone. That concludes my report. I'd be happy to answer any questions.
Thank you. Thank you, Sheila. Any questions for Sheila? No. Great work. Keep it up. I'm really glad to hear that you're doing the tours. I think it's very, very helpful to show those expectant parents what the culture is at Washington Hospital.
And just to add to that, many of us who are actually giving the tours have given birth at Washington Hospital, so that we really make sure to share that as well, because we have had experiences at the hospital.
That's so important. I really appreciate the great work that the Service League has been doing.
Thank you, Dr. Nicholson. Thank you.
All right. Thank you. Next, we've got a quality report with Mary Bowen again.
Yes.
Thank you. Back again. Okay. So this report I'm presenting is our quarter dashboard for quality. And so this is the April, May, and June data this year overall for the quarter. I will also, since we're at the end of the fiscal year, by the end of June at this quarter, I'll be going over a little bit of what everything looks like when it's rolled up over the last year. I will say that this particular quarter, for quarter ending June of 2025, is unique celebration in the fact that literally every metric on the quarterly basis has met or exceeded the benchmark. So overall, great quarter. but we'll also focus a little bit on some of the challenges that we look back on at the end of the year and what we're going to do about those moving forward. So starting in with our infection prevention indicators, we have MRSA in the blood, and we did not have any MRSA cases of patients where MRSA was identified in their blood on day 3 or after while they were admitted. And again, this has been sustained for the 3rd quarter in a row, great outcome. And then moving into our next slide, which is our device-related hospital-associated infections. Our first one is our catheter-associated urinary tract infection. We did have one county this quarter. It is less than expected for a hospital of our size and type. We were able to do a root cause analysis on that, and we have everybody participates in the multidisciplinary team, and we take lessons learned from those cases and apply them at improving our process. 2 quarters before that, as you saw, we had 0. So overall, still looking great with county. And then moving into our central line associated bloodstream infection, which I think this audience is very familiar with the fact that we have sustained an amazing outcome for central line bloodstream infections, remaining at 0. Now we're getting, sort of closer to 3 years like this. And I think I mentioned before that we've even had some community hospitals and some organizations reach out and ask us about our practices, which of course we like to share. And I think this is, again, just a really good reflection of making sure that patients have a central line only when medically necessary. And when it is medically necessary, we take incredibly good care of them and have sustained this outcome of 0. And then moving into our surgical site infections, we did not have any SSIs in the colon this quarter. We did have that one last quarter and have not. And I'll talk a little bit more about surgical site infections when I talk about the fiscal year, but a great quarter at 0 again for this. And then we also had 0 surgical site infections related to our abdominal hysterectomies. We did have the 2 in the prior quarter and have been working on initiatives related to those that were very unique cases. But again, I'm glad to see that has dropped back down to 0. And you can see there was a long sustained period of time prior to that where we did not have infections in this high-risk procedure. And then our C. diff has also remained incredibly low. We did have 2 this quarter. A hospital of our size and type is expected to have closer to what they refer to as 10.9, but basically 11, and we only had 2. We work very closely, as you know, with Dr. Martin, our longtime infection prevention consultant, was a longtime member of the medical staff. We're lucky to still have her on working with us on these, and she works very closely with the IP program. She's continuing to do nursing education on appropriate testing with C. diff, working with the lab, working with the medical staff, and we've really been able to sustain all that. We know not to back off on those efforts and continue to see great outcomes for our patients with this metric. Our other national patient safety goal on how to looking at our hand hygiene. This is measured across all staff and all discipline. As you know, the best way to stop the spread of infections anywhere, and especially in a hospital, is by making sure that everybody is washing their hands when indicated and consistently. So we actually reached an all-time high of 99%. We have a lot of observations in this, I'm happy to report. And those observations that are done with trained observers put in by each unit, and there's a lot of participation in this, and we were still able to demonstrate an incredibly high level of compliance, higher than what Joint Commission even expects and the World Health Organization. This I would attribute definitely to some of the outcomes that I've mentioned prior to this. And then this is what I meant when I said I'm going to talk a little bit about what do we look like at the overall year. And so at the end of fiscal year 2025, we always like to pause and say, okay, so what are we working on in the new fiscal year? What are some areas we have for improvement, sustaining some of our good outcomes? And so out of the indicators I went over, we were able to meet on 5 out of the 7 of those goals. And really what the challenge was this year with infection control was these small amount of surgical site infections that came. Like I mentioned, pointed out the colon surgery. We did have a couple infections on that, and that did put us at more than expected. And the same thing with abdominal hysterectomy. So again, those are two that we didn't quite meet our goal at. The reason why you see a red star there is because we did not meet the goal. But in certain hospitals who do less abdominal hysterectomies, the CDC does not count this smaller volume into a surgical analysis that gives you a SIR, a standardized infection ratio. So we did have that star there, but I just want to be really clear that we recognize that we did not meet the goal with that. We have, these are, again, after all the surgeries that come through this hospital, the high-risk category, these are two that the federal government and local and state government want us watching. And it's a reflection of 4 total surgical site infections. All have gone through peer review. We look at everything with our OR safety, how we clean, how we turn over rooms, surgical practice. So we have done all of that on the background on the prior quarters where these cases existed, and not found anything that, as of significant quality concern. These were high-risk cases. And in addition to that, some of the criteria changed around abdominal hysterectomies, and that led to a little bit of a spike in that. But again, all of these go through a serious, thorough review in the hospital, even if they are a lower volume. And then moving into our nursing sensitive indicators, our falls continue to be below the benchmark. The adjusted measure for our falls that is measured per 1,000 patient days was at 0.33. It is lower than the expected most recent national mean. And this is provided from our national database that we participate on as a magnet hospital known as NDNQI. And so it's a little bit of a stricter benchmark, and we have sustained and met that for 4 quarters in a row. And then also hospital-acquired pressure ulcers, otherwise known as bed sores, did a great job on this for this quarter. We're putting us at 0, far below the expected. And again, we do take this very seriously. We send a crew of trained nurses. They do random checks on patients, known through point prevalence, and we did not find any bed sores. And I think I've mentioned here before that it's really just a good reflection of another magnet hospital with these nurses are rotating patients appropriately, getting them on the right beds that prevent them from developing ulcers, making sure they have appropriate nutrition, making sure that they're mobile when they can be, etc. And so this is a great outcome for the patients not to have to develop pressure ulcers while they're here in the hospital. And when we look at the roll-up for this, I'm very happy to report that we did meet our goals for this year. You can see by the 2 green for an injury and falls. Our actuals, as I said, very low, 0.23, and pressure also 0.21. And again, as you heard our chief of staff recently mention, magnet hospitals typically show, a much higher quality of nursing, and it is measured by these things. And this is part of the indicators that really support that we have excellent standards and quality in nursing here. And then I'm going to move into our readmissions. It's definitely one of our more challenging areas. This quarter, as I mentioned, we did meet all benchmarks for this quarter, starting off with heart attacks, patient who has a heart attack and then gets readmitted into the hospital for any reason at all within the next 30 days of being discharged. We did have 2 of those patients out of 19 potential readmits. 2 of them did come back, giving us a readmission rate of 10.5, but that is lower than the expected of 14.6. And then our next group that we look at that, has always been kind of this challenging area for us around looking at our patients with pneumonia. We were below the benchmark this quarter. We did have 8 patients return this quarter out of 63 potential patients. Our readmission rate then became 12.7. CMS allows it to be around typically expected at 15.3. Pneumonia, as you can see though, throughout the year did go above the benchmark twice. And I'm going to talk a little bit about that when we look at the annualized data, but very happy to report that we've made it under the benchmark again there. And then moving into our heart failure readmission reduction, these patients, of course, very chronically ill and are very high risk for coming back to the hospital. We had 13 patients this quarter come back to the hospital out of a potential of 70. So we were just right there with our readmission rate of 18.6, just ever so slightly under the CMS expectation and goal of 18.8. Lastly, for our COPD patients, this is our last medical group. We have also had this one, as you can see, sort of as a struggle of going above the benchmark. But this last quarter, very happy to report that we only have 4 readmits in COPD patients, and that was out of a potential of 31, putting us at a rate of 12.9. CMS would expect you to be closer to 18.3. And again, these are very chronically ill patients. But we take the 4 that came back incredibly serious, but again, one of our lower times that we've seen, especially when you look at how many were at risk for coming back. This was a great quarter for us on making sure that those patients were able to stay at home and not have to come back to acute care. And moving into our surgical population, patients who have high bypasses, or otherwise known as coronary artery bypass graft. Some of you, of course, know that it is referred to as CABG. We had 0 come back out of 4 patients. And this patient population, we obviously do more than 4 CABGs in a quarter. CMS looks at this metric very specifically in a specific type of procedure. And again, this has to be a specific just Medicare straight patient. And it is just a straight CABG. So, but still, even with those 4 patients, 0 came back. We are very careful with the post-operative management around this, very thorough in our discharge planning, and have a great team who works on the post-op CABG patients. And it's putting us at a 0 readmission rate. The CMS goal is 10.1%. And then one of our largest service lines are patients who come in to have their hips and knees replaced. And for this quarter, we did have 1 patient come back out of 20, giving us a readmission rate of 5%. So it's just right about at the CMS goal. This is a subset population of our patients who come back with knee and hip replacements. But it's important to note that this is what CMS is looking at. They're looking at this patient of inpatient knees and hips. And everybody knows that, over the last few years, this surgical procedure has definitely moved much more towards outpatient. There are patients who meet medical necessity to be in the hospital. They, of course, tend to be more complicated, have some chronic illness, whether it's pain management or hypertension, things that we want to watch really closely. If a patient needs to be here and be an inpatient, they are absolutely made as an inpatient. We want to make sure that they get that extra thorough care and that we are watching them for longer. And we did have 1 of those come back, like I said, so roughly around the benchmark in that small group. Moving on to show what are really the bulk of the service line, which is patients who have this procedure in an outpatient surgery setting or are deemed outpatient because they don't quite have the chronic illness or the risk of complications. We did have 305 patients discharged at this level. We have a great volume on this, and only 2 of those patients came back, and they came back with precautions where we just wanted to watch and do some more monitoring around pain management, especially, and some mobility things that we wanted to make sure that the patients had an opportunity to be admitted back to the hospital. Sometimes these are medical issues and sometimes they're not. Again, only 2 patients out of 305, which gives us a low readmission rate of 0.7%. CMS goal on this would be closer to 5. So again, great outcomes in an amazing service line that really is very organized and gives incredible comprehensive care, lots of pre-education, watched very closely. I do also want to highlight the fact that when these outpatients have this surgery, they typically have a great opportunity of going home with home health. We work with great home health agencies that are prepared to take care of these patients. And it's nice to see that they're able to get back home, and very few have to go on to a skilled nursing facility. Again, if they need that service, they go to a skilled nursing facility, but we're experiencing great outcomes here. And when we roll up our readmissions for the year and take this look back at how did we do overall in the year, we did meet 4 out of the 7 of these goals. And as you can see, our surgical populations have not been a concern. And we've had improvements related to our AMI patients, which was great to see. But we still need to do some work on focusing on these other very complex medical conditions, especially pneumonia, heart failure, and COPD. So one of the things that we have spent a lot of time on in the last couple months is large groups on everywhere from our executive team to our strategic team to people who work in transition care to nursing, case management, really have spent a lot of time in the last few months talking about what do we want to do to make sure that this patient population is well addressed and that we're managing their care from day one of arrival and create a great transitional care plan for them so that they are not at risk for coming back to the hospital. So because of that, we have identified that in our fiscal year that started July 1st, we really want to make this an organizational priority, a strategic priority, and we're going to focus also on all-cause readmissions. So we're actually going beyond the patient populations that you see here and looking at patients in other areas and expanding that because those patients also deserve an opportunity for improvement in quality. And this is a hospital system-wide initiative that we're working on, and we're looking at things with provider management, so doctors, and looking at making sure that we're following standards in care. Do these patients have what they need prior to leaving? What about the support system at home? As we know, that is our biggest challenging area typically. Medication management, transportation, helping them manage different situations that are going on at home with making sure that support is available and really making sure that we contact these patients within 3 days of discharge. And what I'm really excited about in this upcoming year is that it is really the whole team steering together and really putting all of our heads together to see what we can do to reach these goals so our patients can even take this level of quality of care to the next level. I'm excited to see that. We have a lot of willingness and readiness across the teams to focus on this moving forward. So you'll be hearing more from me about that as I present on my quarterly data for this upcoming fiscal year. And I am happy to answer any questions. Thank you.
Thank you. Any comments or questions from Mary?
The only comment I have is, Mary, I remember really distinctly when we were having so much trouble with hand hygiene.
Yeah.
Wonderful to see that we're sitting in a long period now. Really wonderful.
Yeah. And thank you for recognizing the importance of it. It is absolutely essential. And we have implemented electronic monitoring, done a lot of training through the patient safety team. We put quite a bit of emphasis and focus on multiple huddle boards throughout the hospital, talking about, the importance of this. It is something that you're never really going to be in a position where you can back off and stop worrying about hand hygiene. We will always have to push forward and work on it to this extent. And I agree. It's great to see that it really protects our patients and it protects our healthcare workers also. And so, thank you for acknowledging that.
Yeah, Mary, I concur on the hand hygiene. And I also wanted to say great work on the falls and the pressure ulcers. That's just great to see, and good to see the progress that we've made in the readmissions, which have been a very difficult issue to work on. And it's good to see such great progress, especially this last quarter. So thank you and your team, and especially to all of the nurses and physicians who actually make this stuff happen. It shows that care can be delivered here in a safe fashion, and patients should feel comfortable coming to the hospital and reassured that they can get care in a safe fashion. Thanks again.
Absolutely no, and thank you for your ongoing support and recognizing that and the efforts that we're making. And you are right that one of the core values we've always followed with readmissions is that if a patient needs to come back and to be admitted, that is something that we do not even question, and we admit them and make sure they get the care that they need. Thank you.
Mary, I think it's a great presentation, but my only suggestion would be in the infection prevention indicators, it may be good to add the denominators also. Abdominal hysterectomy, how many hysterectomies have you had this quarter compared to last quarter? Because otherwise some people make an argument. Patients are much less this quarter because numbers are much less compared to the last quarter. So I think it's probably good to have the denominator numbers too.
Correct. And I think that I just didn't hear the last part if there was a question in that.
No, there's no question. What I'm saying is it's probably good to have the numbers. You know, how many cases were done.
Oh, yes. Oh, very helpful. I know that's one of the things that, especially our biostatistician is always very focused on that also. You're right, because especially if you look at it compared to the overall pool of them. And as we move forward and expand this to all cause, I mean, not just all cause, but to the all readmissions, that will also become especially important. And of course, in every patient, even if it's a small numerator, we do recognize that every single patient matters and needs attention. And that's where really a lot of Dr. Akawili's work comes in. She reviews every single one of those cases and gets feedback from attendings and works with the team and takes every single one seriously. And so breaking out the numbers is helpful. So yes, thank you.
Thanks. Great. Thank you, Dr. Ethan. Any other comments? Okay, thank you, Mary. Look
Thank
forward
you.
to the next presentation. Yeah.
Thank you so much.
Okay, we'll now move on to our finance report. Ajay?
Thank you. I'll just start by saying these are results from June of 2025. So, as you know, that's the end of our fiscal year. And the results I will provide are preliminary to audit, so there might be some adjustments as we go through the audit process. Hopefully not. You will recall that during the FY26 budget talks we had projected a $6.1 million loss from operations and $21.3 million net income margin. Happy to report that our preliminary June year-to-date shows a net operating loss of $4.8 million, so a little better than what we were projecting. And the net income was $1.3. Having said that, let me get into some of the actual data. Our census, our inpatient census was a little under budget for the month as it was for the year. Discharges were very close to budget, and for the year we're actually 123 ahead of budget. Patient days on both counts were a little behind budget, which is not a bad thing. It's lowering the length of stay, and I think you'll see that as it goes along. Our outpatient observation days, although they show as being negative, again, that's not a bad thing. That's a good thing. We're doing a much better job in getting our patients with the right level of care. And as you can see, our length of stay for the year was about 9 basis points lower than actual. Next slide. On the continuing operating indicators, our case mix index was lower for the month than budget, but overall for the year, we were better. Deliveries at 152, we were 15 over budget, and similarly for the year, 138 over budget. Surgical cases, we did not hit the mark in the month. We were 112 below, and majority for the loss of the year was in this month. I think we were, if you recall last month when Kimberly was doing stats, we pointed out that there were some anomalies in this data. I think the surgical cases were budgeted a little higher than we could possibly. We've never seen a number of 611 here before, I don't think so. We were a little exuberant about that number. Cath lab cases were also budgeted a little high, and we were 43 behind that, and on the year 120. Outpatient visits, great story, 170 over budget and 353 on the year basis. ED visits, we were a little behind budget, 174 for the month, but about 2,000 under for the year.
I just wanted to comment, it's nice to see the deliveries almost 10% over budget.
And the trend has carried on into this year, so that's great.
That's a lovely thing to see.
I was just about to comment on that because the county birth rate hasn't gone up.
Right.
But some of our deliveries the last 6 months gone constantly.
And I think it might be a function, I heard that one hospital closed down there. So that's a piece of it. And then I think we've added some docs and stuff.
And it's probably also good to find out if somebody's coming for delivery into the second child, and the first child was born somewhere else, like Elkham or something. Then what made him come back?
Yeah.
That'd be, I think, a good thing to find out so that we can focus on that. And
maybe it's the service league tours.
We won't comment on that.
I think all of that is helpful, but it's just nice to see all that new life being brought forth. And here we had one of our presenters in the livestock.
Second generation.
Yeah.
Same room. Same room.
Yeah.
Yay for not changing anything.
See that. Our surgical and cath lab indicators, surgery cases were down a little bit, as I mentioned earlier. Cath lab cases were also a little down. And for the year, cardiac cath lab was ahead of plan, so I think that trend really carried on in July, and you'll see some of that data. Sorry, I'm stealing Kimberly's time. On our FTE basis, we did really well. Our FTEs were 95.3 below budget, and on the year-to-date basis, 88 below. And adjusted on FTEs per adjusted occupied bed were also on both cases below budget. Now getting to our financials on our contractuals and deductions for the month. We were almost right on budget at 77.25 against a budget of 77.2. You'll see our actual gross charges were a little low for the month, but on a year-to-date basis, we were almost 54 million higher gross charges. And the total deductions on a year-to-date basis were about 0.25%, which sort of indicates, as you can imagine, slightly deteriorating payer mix. As we move on to the next slide, our net operating revenue for the month was 1.3% below budget at 51.3 million. Year-to-date basis, we had 628.4 million, about 7 million ahead of budget. Our operating expenses for the month were fairly close, off by about 170,000. On a year-to-date basis, we were off about 15.6 million. And we've talked about this in the past, but I'll just refresh that the majority of this is coming, about 10 million of this is coming just out of our benefits. Our medical expenses have been higher, our pension and OPEB costs have been higher. So of that 15 million, roughly 10 million is coming out of just the benefits. And then there are supplies and our labor costs are a little also. So those are some of the things contributing then to our operating margin being behind budget. Our net operating income is negative 4.8 million versus on a year-to-date basis versus we budgeted a margin of 3.8 million, a variance of about $8.7 million on a year-to-date basis. Good news is on the net income margin, we did better on our non-operating income than budget. We were budgeted for 13 million. We actually came in at about 26.1 million. So our net operating margin, the net income is 21.2 million, 3.4% versus the budget of 16.8 million. And I talked to you a little bit earlier about the projections we've made. So just to keep it in context.
How much, Ajay, how much of the non-operating income boost was due to the anomaly with the property tax?
That's about $9 million on the year-to-date. So this was a large portion was that. So what that was they underpaid us in previous years, so there was a catch-up. There'll be a little bit of a catch-up again this year, but we budgeted for it. So
is it going to go down next year, or do we know?
I mean, we won't have that catch-up. So
we won't have a catch-up. We won't have a payback.
No.
Okay.
Next slide. So that was the GASB format. I won't spend a whole lot of time on the FASB format. As you know, there's a slight difference there, and we're also behind budget on this format. Last but not the least is the EBITDA slide, which I'd just like to point out. On a year-to-date basis, we came in at an EBITDA of 6%. We budgeted 7.3%. And we already talked about the net income margin of 1.2 versus 16.8. Any questions?
Any questions? Thank you, Ajay.
All right. I'm going to provide preliminary operations report for July, and we're starting the new fiscal year. So I want to begin with outpatient observation days. They came in at 166, which was 41.8% or 119 favorable to the budget of 285. Now, we did budget conservatively because when we were budgeting, we really just had a few of the months that when we had started this initiative. So we just, we want that we are continuing, and as you can see, we've been pretty consistent in terms of where we've been in terms of the observation days. So continuing that good trend. Then looking at the preliminary total gross revenue, we came in at $230.8 million for July, which was favorable to the budget of $227.9 million by $2.9 million or 1.3%. It was also favorable to compared to July of 2024 by 4.8% or $10.5 million. We'll talk about it more, but you can see July's performance is mainly driven by outpatient gross revenue that came in at $2.1 million above budget. Looking at trauma, we did an excellent job of budgeting this year, right for the first month, right on budget at 151 cases. And we were favorable to last year by 32 cases or 26.9%. And this is through 1 year of being a trauma center. Inpatient trauma cases of 48 for July were unfavorable to the budget of 54 by 6 or 11.1%. And outpatient trauma cases of 103 for July were favorable to the budget of 97 by 6 or 6.2%. So closer in terms of what we budgeted, but still off a little bit inpatient compared to outpatient. You'll also see in terms of inpatient that we had less complexity of our trauma cases. Looking at the activation codes, as you can see, is how they're broken down by acuity level. We had 12 Alpha, which is the highest level of acuity, followed by 33 Bravo and 106 Delta. Once again, in terms of the 151, the most types of cases we saw were 55 of falls, also then 24 motor vehicle crashes, 7 with medical symptoms, 4 with bodily injuries, and others. Moving on to the trauma gross revenue, as mentioned, we came in at $15.4 million for July, which was unfavorable to the budget of $18 million by about $2.6 million or 14.6%. but favorable to last year by 3.3 or 3.3 million or 27%. As mentioned, in terms of inpatient gross revenue was unfavorable to the budget by about 3 million or 22.8%. Due to two pieces, the less cases and also the complexity of those inpatients. We'll keep an eye on this in terms of the types of cases on the inpatient side. Moving on to preliminary inpatient total gross revenue, it came in at 142.5 million, which was consistent with a budget of 0.7 million or 0.5%. And 13.5 million or 10.5% higher than July of 2024. You'll see our performance was really driven by our cath lab services, surgical services, and birthing center. Looking at our outpatient gross revenue, it came in at 88.3 million, which was favorable to the budget by 2.1 million or 2.4%, but 3 million or 3.3% unfavorable to July of 2024, and a lot of this was due to the shift in our observation types of cases, when you compare it to July. Inpatient average length of stay for the month of July is 5.02 and was favorable to the budget of 5.23 by 0.21 or 4.2%, and also favorable to July of 2024 by 9.8%. You can see July of 2020, well, I should say July of 2020, the fiscal year 25. Yes. Also, in there you can see the CMI, the case mix index, and the length of stay divided by the CMI was at 3.30 in June and went down to 3.10 in July. Looking at our discharges for July, we had 1,111, which was favorable to the budget of 1,053 by 58 or 5.5%. At that time, at the end of the month, we had 7 patients that were over 30 days still in house. Our patient day trends, patient days were at 5,401. They were unfavorable to the budget of 5,509 by 1.9%, and this is really driven by our lower length of stay. And as Ajay said, having lower patient days is not necessarily, it is less than budget and not necessarily a bad thing. And also just in terms of, if you remember, we talked a little bit about, we still have our intermediate care unit that has moved up to the 3rd floor of more time, and so we do have some beds that are down, and just making sure, continuing to work to get our patients in the right levels of care given where we are today. But in construction in that area that is being impacted should be done by the end of August. So we're looking at the beginning of September to be back, moving IMC back to the center. Looking at our inpatient average daily census, it came in at 174.2, unfavorable to the budget of 177.7 by 1.9%, due mainly again to the lower patient days, but was favorable to July of 2020. Moving on to our surgical trend, you can see total surgeries in July of 526 were favorable to the budget of 515 by 11 or 2.1%, and were 8 or 1.5% favorable to July of 2024. We were favorable in terms of inpatient surgeries compared to the budget by 18.7%. Outpatient surgeries, came in at 234. That was unfavorable to the budget by 13%. We did have some physicians that were out of town, and we had 8 TAVR cases that were performed in July. And next, you can see surgical activity in terms of where we stood. It's broken down. As you can see, in terms of GI and gastroenterology and orthopedics, we were down again, and vascular by 1 cases, but mainly with GI, we had patients or physicians that were out of town, and also in orthopedics, we had 2 that were also out of town. We're continuing to see some of that movement over to the outpatient surgery. At Cath Lab, as mentioned, we had a busy month in our Cath Lab. July, we had 228 cases that were favorable to the budget by 43 or 23.2%, and the highest monthly volume we've seen over at least the past 13 months. Cath Lab inpatient cases came in at 142, was favorable to the budget by 36.5%. You'll see that mainly in cardiac and interventional radiology. And outpatient Cath Lab cases were also favorable to the budget by 6. We did 3 MitraClip and 9 Watchman cases in July. Next, you can, on the Cath Lab activity, you can see it broken down. As I mentioned, next slide, please. In terms of, broken down in terms of cardiac was over budget by 19.8%, interventional radiology by 23.2%. So again, another, and also neuro IR by 3 cases or 33.2%. All right, moving on to deliveries. Once again, we came in at 152 cases. As I always mention, this is preliminary. I know it says 147 for June up there, but came in once again at 152 cases, was favorable to the budget by 15.2%, so continue to have busy time in the birthing center. We also had another 6 deliveries that we're not counting in that 152 at this point because they're in the process of charges being put in for those. So we even hit higher than 152 actual cases that we're tracking the revenue with the deliveries on this. Non-emergency department outpatient visits, they also had a strong month. You can see they were favorable to the budget by 858 or 9.8%. Also the highest monthly volume in the past 13 months and also favorable to July of 2024. We really saw favorable performances in a number of areas, including outpatient wound, X-ray, lab visits, and EKG. So a busy month for many of our outpatient services. Moving on to departments, emergency department visits. They came in at 5,089. They were unfavorable to the budget by 197 visits or 3.7%. So, but also unfavorable to July of 2024 by 4.2%. Again, in terms of seeing across the board, the types of cases really focus, seeing a number of the level 5 cases sort of comprehensive, not to that highest level, but again, 151 trauma cases also count. Moving on to our gross revenue and looking at the recap, really tied a great deal to volume. You can see with surgical services above budget by 0.3% in terms of gross revenue. Cath Lab, as we talked about, very busy, above this number of cases by 43 or 23%, and you can see Cath Lab gross revenue above budget by 15.4%. Room and board was unfavorable to the budget by $3.2 million, again, mainly driven by the lower patient days and also lower trauma revenue. Emergency department also below budget by 6.4% in terms of $1.1 million. Again, visits were below budget by 3.4%. And ancillary revenue was above budget by 3.8% or $4 million. Moving on to our preliminary payer mix, overall pretty consistent with budget, as you can see with our government payers. HMO was down, unfavorable to budget by 1.5%, coming in at 2.6%. But we did see an uptick in PPO business from to 20.7% compared to a budget of 19%. So saw a small uptick in self-pay, but again, pretty consistent with our budgeting. Looking at our productivity indicators, starting with our productive FTEs, they came in for July at 1,463.6 FTEs, which was favorable to the flex by 45 or 3.1%. Moving on to non-productive FTEs, also favorable to the budget by 14.7 or 6.5% at 200 and 29.1 in terms of FTEs, but unfavorable to July of 2022. Yeah. Preliminary total FTEs for July were favorable to flex by 59.7 or 3.5% at 1,690.8. And our total FTEs per adjusted occupied bed came in at 5.99, which was favorable to the budget of 6.13 by 2.3%. Overall, continuing that focus on really looking at our productive FTEs. All right, moving on to radiation oncology. As you can see, for July, our treatments came in at 330 for the month, which was unfavorable to the budget by 16.7%. Again, we continue to see a number of breast cases that are using basically less fractions or in terms of treatments. I will say our revenue is on budget because we're seeing more complex cases and doing more IMRT. So in terms of the types of treatment that we are providing, we also a couple months ago had a number of our physicians that were out, so the referrals are coming in terms of that a little bit slower in terms of they impacted the number of treatments, and we'll see that picking up again as we go. You can see we did have a strong month for consults. We had 33 new referrals that came in, and we saw 31 new patients too. We had a conversion rate of 36%. That was up from the previous month. So 12 converted out of our 33 referrals. Looking at the Washington Health Medical Group, the visits were consistent with the budget by 27 or 0.2% in terms of that. Our primary care visits, including pediatrics, was right on budget by 0.6% and higher than July of 2024. Our specialty visits were also just a little under budget by 0.9%. We did have neurosurgery. We had an open PA. We have an open PA position in that area, and then also low budget in ortho. Moving on to our development corporation, we had a strong month. The outpatient visits came in at 2,596, which was favorable to the budget by 7.6%. Rehab visits were favorable to the budget by 17.7%. Our Washington Outpatient Surgery Center cases were below budget by 13%, really driven by, again, we had one of our gastroenterology physicians and others had time off, so that was driving that. And also with Peninsula Surgery Center, it came in unfavorable to the budget by 44 cases, and again, we had 2 of our orthopedic surgeons that were out for the month of July. Lastly, our preliminary key financial statistics. July, our days cash on hand came in at 118 days for July. Had mainly due to we had to pay out our joint venture distribution for radiation oncology, some of that, and so that is really what's been driving the decrease in the days. We will be seeing some additional, as you know, we do intergovernmental transfers, and we will have additional payments that will be coming back to us too in the upcoming months that will be helping to drive that back up. And at the end of the fiscal year, we had a number of other cash that was being paid out, and with also with construction and other pieces going on. So we've been seeing a lot that working on bringing that back up. What did you say? We have them coming in towards the fall?
Yeah, so our next payment is we first pre-fund it and then we get the money back. The pre-fund will happen towards the end of August 22nd. And then we expect it to wash back through around
late September, sometime. Okay.
Yeah. All right. Any questions for July? All right, I'll move on to Employee of the Month and then the calendar. All right. My pleasure to introduce our Employee of the Month for August. It is Jen Hugh. She's a staff nurse 2 on 4 West. Her journey at Washington began in 2020 as a dialysis nurse and has since demonstrated exceptional growth, adaptability, and commitment to patient care. She transitioned to inpatient medical surgical nursing, contributing her talents on both 6 West and most recently on 4 West. She has also completed charge nurse competency, is now able to support postpartum care in the birthing center. This is truly a testament to her clinical versatility and drive for excellence. Jing brings a global perspective to her work, having received nursing training in both Beijing and Australia before continuing her career here in the United States. Her diverse background enriches the care she provides and strengthens her ability to connect with patients from all walks of life. She is recognized among her colleagues for her willingness to help and for routinely going the extra mile for both coworkers and patients. This attribute caused Jing to be recognized as a Daisy Award recipient in 2023. Her dedication and kindness often leave a lasting impression on those around her. One colleague shared, I quote, "Jing was thoughtful enough to call me after I developed an infection. She volunteered to run errands for me and even waited in line to pick up prescriptions on her day off. I will never forget what she did for me." Another sentiment, a patient echoed the same type of heartfelt message. Jing is an exemplary nurse and a very humble person. During my stay, I was uncomfortable and in pain. She was very caring, and I commented that she truly cares about the patients and is a valuable asset to the team. So outside of work, she is a proud mother of 2 sons, ages 21 and 10, and enjoys an active life with them, including hiking and mountain biking. Her eldest son is enrolled in the nursing program at Emory University. Congratulations, Jing, on August Employee of the Month. All right, move on to our outreach events and just highlight a few of those. And you will see we've been busy with the Fremont Concert Series on July 17th. We were there and did 119 blood pressure screens. Also, we were there on July 10th and was really partnered with the National Coalition Against Prescription Drug Abuse and Haller's Pharmacy. We did blood pressure screenings, but also gave out Narcan kits that were distributed. Also want to say we were at the Niles Dog Show, and we had an education booth with our Service League Whoop Canine Therapy team. You can see we had 300 interactions. Moving on, Dr. Eric McDonald on July 23rd did a Facebook and YouTube community education on anterior total hip arthroplasty, and he had over 4,000 views. Then we had July 24th, we had Fremont Concert Series. July 27th, the Newark Mariachi Festival. We had an education booth and did blood pressure screenings. And then once again, July 31st, we were at the Fremont Concert Series. Moving on, August 1st, we did participate in Tiburcio Vasquez's Health Center Women's, Infants, and Children Nutrition and Resource Fair. We had over 220 booth interactions. Our WIA, our employee group contributed over 20 backpacks to save. Also on Monday, August 11th, we had a very successful Women's Welcome Teacher Day. It was, and we gave out over 1,300 flowers. I know I heard that we ran out towards the end. We had a lot of children that came in that were there giving flowers to give to their teachers the next day. So it's always a fun event to do.
That's a great service.
And really, we just, in terms of handing out information, and really want to thank Dirk Lorenz and his group of volunteers. We had a lot of volunteers from many areas through our own volunteers and people that participated. So really want to thank everybody that helped to make that successful. And tonight, you can see we do have Victor Chen, a radiation oncologist, doing a Facebook and YouTube education. A number of pictures here.
Not good-looking people.
And as you can see, in August, we continue to have a number of outreach events that we're participating in. We have the Festival of India that's happening this weekend. Also, you can see with neurosciences, we have Maria Nunes that is doing a Washington Health Walk, focusing on cholesterol and blood pressure in Union City. We also have Heart Health for South Asians. We're doing Facebook and YouTube on August 27th. And then lastly, again, Maria Nunes is busy and out, this time focusing on diabetes in Union City. And lastly, Christy Kara Kappa on September 10th, doing Facebook and YouTube on Medicare, what you need to know. I just want to lastly remind everybody that we do have our 39th annual Top Hat Gala that is taking place on October 11th. Funds will go to support the Da Vinci robot and other robotic programs that we have. So very excited about that too. That is what I have.
Thank you, Kimberly. We have no action items for tonight. Kimberly, do you have any announcements?
I do not.
No announcements, there's no announcements, and no action. This meeting is adjourned.